All right, welcome back to ABA exam review and the continuation of our RBT practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is teaching a young child to pick up their toy blocks and place them in a box. When the child picks up a toy, the behavior analyst slides the block closer to the child after each block is picked up, making it easier for the child to complete the task. What type of prompt is the analyst using? So we have a prompting question, and the question makes that obvious here. Sometimes it might not be obvious if we're looking at prompts or SDs. In this case, the question is saying we have a prompt, and they want us to identify the type of prompt that the analyst is using. Now, when you think about prompts, and this is a little bit more high level, but we have what you call response prompts and stimulus prompts. Response prompts act directly on the response you want to see, where stimulus prompts are manipulating something in the environment. In this case, the analyst wants the young child to pick up their toy blocks and put them in a box. So when the child does pick up the toy, what does the behavior analyst do? Well, they slide the box closer to the child after each block is picked up. What is the analyst manipulating? Well, they're manipulating the stimulus in a way to evoke the behavior they want to see. They're not necessarily acting directly on the response of picking up the toys and putting them in the box, but they are manipulating a stimulus in the environment. Now, with this, what type of prompt is that analyst using? A gestural prompt. A gestural prompt is going to act on the response itself, and it's going to be a motor movement indicating what we want to see. In this case, the analyst was not gesturing, but they were actually moving the actual stimulus and manipulating the stimulus itself. B, physical prompt. The analyst did not physically prompt the child, so we know physical prompt is out. C, positional prompt. Yes, with the movement of the box, the analyst is changing the position of the stimulus, which is evoking the response they want to see. That is the prompt we're looking at. And then D, modeling prompt. Is the analyst modeling how to pick up toys? No, they're not doing the modeling. The child is not imitating. All the analyst did was change the location of the box to evoke the behavior they wanted to see. So the type of prompt they used was C, positional prompt. A researcher is studying how long it takes participants to complete a puzzle after specific types of observation and training. The researcher will start a stopwatch when the participant begins and stop it when the puzzle is finished. They do this each time the participants attempt the puzzle. This is an example of measuring blank. Okay, we have a measurement question. With the measurement question, we want to know a couple things. What are we measuring? And then are we continuously or discontinuously measuring? And then are we measuring time or a count? In this case, we know we're measuring how long, so we're measuring time, it takes to complete a puzzle. So the behavior is completing a puzzle. We're measuring how long it takes to complete a puzzle. Now, just from that information, it is going to become pretty obvious what type of measurement we're using, but let's just read a little farther. The researcher starts a stopwatch when the participant begins, stops it when the puzzle is finished. So what is the researcher measuring? Well, they're measuring a discrete response, right? A discrete response has a clear beginning and a clear end. This researcher is measuring how long from the beginning to the end it takes someone to complete a puzzle. So what is the researcher measuring? A, duration. Yes, duration measures the length of a discrete response. In this case, how long to complete a puzzle from the beginning to the very end when the puzzle is finished. Pretty straightforward measurement question, but we want to break it down in practice so we really develop a strong understanding of each of our measurement strategies. If we think about latency and inter-response time, those also measure time, like a length of time, but those measure time in between things. We're not measuring time in between here. We're measuring a discrete response, which is going to make it duration. And then D, rate. Rate has to do with a count, and we're not counting anything. We have no frequency. We can't have rate. You can't have rate without frequency. So in this case, this is an example of measuring a discrete response, how long it's taking, or duration. Lisa, an occupational therapist, is working in a busy outpatient clinic. She wants to measure a client's pacing during a treadmill session, but only has time to check periodically due to scheduling constraints. Given Lisa's limited availability, which measurement procedure would be most feasible to capture the critical dimension of the treadmill behavior? Now, this is a more challenging question. You've got to think a little deeper about measurement in this case because we're not necessarily thinking about measuring or why we're measuring the specific behavior. We're more thinking about Lisa and what she's capable of doing. If we think about continuous and discontinuous measurement, continuous measurement, things like duration and frequency and rate and interresponse time and latency, we're measuring every instance of behavior, meaning we have to be around the entire time. It's time intensive, it's resource intensive. Discontinuous measurement allows someone like Lisa, who's busy and doesn't have a lot of time, and maybe can only check periodically on the behavior to still collect data. So, given Lisa's constraints and limited availability, what do we know immediately? We know she's going to be using discontinuous measurement. She can't be using a continuous duration recording if she can only check periodically on the behavior. To use continuous recording, you've got to measure the behavior the entire time. So she can use partial interval, right? Because that is discontinuous. However, even with partial interval recording, you still have to watch until the behavior happens. So if Lisa can only check periodically, she's still missing some of the crucial parts of behavior. With momentary time sampling, however, you only have to be there at the end of the interval. So if Lisa can only check periodically, then she can set it up to where she only has to check in the moment, the momentary time, right, of the end of the interval, and she can take C, momentary time sampling. And then D, rate recording, that is also continuous, and we're not measuring a frequency. We're not necessarily counting things here, right? We're looking at pacing. Regardless, rate is continuous. It's not what we're going to recommend to Lisa. What Lisa would most likely use is something like momentary time sampling. That is a much more high-level question, and so hopefully you critically worked through it and got there. If not, understand why Lisa's limited time led us to discontinuous measurement. You, a behavior technician, notice that one of your colleagues uses a few different punishment interventions, often with their client. You're unsure whether these interventions are approved or not and want to make sure the client is getting the best possible treatment. What should you do first? This puts you in a tough situation as a technician. You're in an environment where you're working with other technicians and you want to be supportive and you want to help each other. But when you see something that might threaten to harm a client, that becomes your number one responsibility because our number one responsibility is do no harm. So if you are seeing one of your colleagues is using these different punishment interventions and you're not sure if they're approved and you want to make sure the client is getting the best possible treatment, what can you do as a technician? What is your responsibility here as the technician to protect the client, of course, but you also need to be aware of what your role is in this particular environment and that your colleague is also doing a job. So what should you do first? A, confront the behavior technician and remind them that the punishment should be used as a last resort. It's not your role to train that technician or correct them. That's the supervisor's role. Unless you're in some sort of lead position, and that is your responsibility. But all we know here is you're just a normal behavior technician, meaning it's not your role to go around and correct other technicians without more information. B, remind the behavior technician that if they're going to use punishment, they should also use reinforcement. Again, we only have limited information here. You can't go up and correct their treatment without knowing more. So before you do anything, C, reach out to the supervising behavior analyst and ask about the treatment plan. If you are truly concerned with the treatment plan, then you need to reach out and figure out what is that plan. And you can do it in a nice way. You can ask the supervisor or say, I saw this happening on your case. I was curious about the treatment plan. I wanted to know more. It's a very easy way to do it. Either that supervisor says, yes, that's what we're doing, or they say no, and they handle it themselves. Either way, you've addressed the issue in a respectful way. And then D, report the behavior technician to the supervising behavior analyst. Again, you're not reporting anybody. You don't know much at all except for what you've observed and seen. You've got to get the full picture before really making a decision. The best thing you can do here is reach out to the supervising behavior analyst and ask about the treatment plan. Gary tells his roommate he desperately needs to pass his upcoming exam. Gary asks his roommate to lock him in his room and only lock the door so that Gary can only get out when Gary is done studying. If this increases how much Gary studies in the future, what type of consequence occurred? A couple of different things here. It is a consequence, right? So a consequence question. And we want to know how behavior changes when consequences are involved. Well, the question is saying, if the behavior increases, then what kind of consequence is it? Well, if the behavior increases, it can only be one type, and that's reinforcement. We immediately know this is reinforcement because the behavior increased. Now we have to ask ourselves, is it positive or negative? What is Gary doing? Well, Gary wants to pass his exam. So when Gary is studying, his roommate locks him in the room. Only once Gary is done studying can he get out. So Gary studying leads to what? Leads to Gary escaping the room. And when we have escape that increases behavior, we consider that a negative reinforcement. It isn't negative punishment or positive punishment because it's increasing behavior and punishment only decreases. And it isn't positive reinforcement. From studying, Gary isn't getting anything except to escape. And escape is getting away from a negative stimulus or an aversive situation, which is going to be a negative reinforcement. Thanks for watching. Please check out btexamreview.com for all of our study materials. That link is in the comments below. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.